Hi, everyone, and welcome to the World Doc Allen podcast. So I'm excited first to welcome World Doc Allen Lindeman. Doc Allen, how are you?
I'm very good. Thank you, Neil.
So the exciting thing is the membership site, and wanted to kind of explain more and more how important this site is by going to your website. And the reason is because now people can go ahead and ask questions to a doctor on a forum website that's not available many places. Most of them are nurses or people that have some patient advocacy but are not doctors. So they can ask any types of questions, right?
That's exactly right. Anything from what to eat and controlling nausea to VBACs and shoulder dystocia and vaginal breaches and many kinds of questions.
And even in that process, when you're first pregnant, it's important to ask questions when you're concerned instead of doing a quick Google search, because those quick Google searches can become really scare you because there's multiple answers out there versus getting an answer from a doctor right off the bat where you are giving the information versus a website that's just giving it in a blog form or based on one person's experience.
One of the problems with the internet is that the people who are talking there or writing, they don't necessarily get to see how people are reacting to what they're saying. So this is one of the things we want to do is get some kind of interaction.
And that interaction is huge because an important thing in asking those specific questions. What about after delivering the baby? Do you provide some of those answers as well? The questions, especially mothers recovering from surgery, or if they did have a C-section, or other times, those are types of questions they can ask as well, right?
Absolutely.
And how many of those, like in that process, that you're constantly working after delivering that baby, are you involved with your patients for 6 months, 9 months after the birth, right?
I'm very careful with following patients. And I believe that like most of the Scandinavian countries and the countries that do better than we do with maternal mortality, they follow their patients for a year. And one of the nice things about having an independent practice, as I did for many years, is I don't have to get permission for somebody to see a patient and not get paid for it.
That's very important. No doubt. Absolutely. For sure. And so people can go right now to register to become a member of the website by going where?
WorldDocAllen.com.
And then once you get to worlddocallen.com, you're going to be able to find where you register. And it's free at first, and then there's other types of components. So first, it's absolutely free to register, to be able to read the forums, read what's happening, and get the information you need right now from a real live doctor. So we appreciate it for you to be able to provide this service to people across the country.
Well, thank you very much, Neil. You've taken the words out of my mouth.
All right, so take care, and thanks for stopping by your podcast again. It's another pleasure.
Thank you.
All right, that was the World Doc Allen podcast, guys. Take care.